Hello, I'm Dr. Jamuna Joy from Amala Institute of Medical Sciences, Thrissur, and I'll be talking to you on breast cancer. The breast is a modified sebaceous gland which is designed to produce milk, and it is made up of glandular tissue and mammary fat. It also has parts like lobules and lactiferous ducts. So we call it breast cancer when there is an abnormal growth of cells within the breast, and these tumor cells multiply quickly, and they also have a tendency to spread to regional areas or different areas like the lymph nodes or other normal organs of the body. So, breast cancer is one of the leading causes of cancer in women. Not only in women but in men also, breast cancer is seen, but it is less common. And the incidence of occurrence of breast cancer increases with increasing age. It has been seen that 5 to 10% of breast cancer is inherited. Among these, BRCA1, BRCA2, and P53 gene mutations are the most common. Workup of a carcinoma breast patient includes collecting the baseline history, that is, the occurrence of symptoms, how long the symptoms have been present for the patient, if there have been any associated symptoms during this time period. Also, other risk factors need to be looked into, like family history of cancer, her age of attaining menarche or menopause, if she has been on any hormone therapy or oral contraceptive pills, if she has been exposed to radiation therapy, or her lifestyle changes, like if she recently started smoking or has stopped smoking, if she is obese, all these factors needs to be looked into. Now, apart from these, we need to get a detailed history of her medical comorbidities, including hypertension, diabetes, cardiac disorders, any other illness like asthma or thyroid disorders, etc., and the medications that she is taking for the same. So the common symptoms that a patient can come include lump or thickening in the breast with or without pain in the lump. There can be clear or bloody nipple discharge, nipple retraction, change in size or contours of the breast, or there can be a sudden increase in the size of the lump or a slow gradual increase in the size of the swelling. There can be redness or pitting of skin over the breast, ulceration or bleeding from breast lump. Now, apart from these symptoms, if the disease has spread to beyond the breast tissue and has started involving the lymph nodes or the distant organs, then symptoms depending on the organ that has been affected. So, for the clinical examination, we need to examine both breasts of the patient and look into the size, the site, and the consistency of the breast swelling. Also, the lymph nodes that have been involved because of the breast disease. The common lymph nodes that are expected to be involved are axillary lymph nodes, the infraclavicular lymph nodes, that the nodes which are seen just below the clavicle, and the supraclavicular lymph nodes. These are lymph nodes which are seen above the level of the clavicle. There are certain investigations that need to be done as part of the workup. Firstly, the routine investigations that include hemogram, the renal function tests, and the liver function tests. Apart from these, we need to confirm the diagnosis of the breast carcinoma. For that, we need an FNAC, that is a fine needle aspiration cytology from the breast lump. So a fine needle is inserted into the lump and a little bit of the tissue is taken, and that is aspirate is taken and sent for examination and looked in through the microscope, and here we can see if there are any malignant cells which are present or not. This much information can be got from a FNAC of the breast lump. Now, core biopsy or true cut biopsy is using a different needle to get more tissue from the breast lump. So, this helps to identify detail of the tumor cell, that is the type of the tumor cell, and other factors can also be studied like IHC, which will be discussed later. So coming to the pathologic assessment, so once the surgical tumor is removed, that is when we can assess it with our naked eyes. That is called macroscopic assessment of the tumor. We should look at the size of the tumor, the site of the tumor, the appearance of the tumor, and other factors. Microscopy is the use of microscope to assess the cells of the specimen. We need to look into the tumor type, the nodes involved, IHC study, and finally the stage of the disease. So when you discuss about the tumor, the pathologist reports the size of the tumor, the type of the tumor. There can be invasive lobular carcinoma or ductal carcinoma in situ. These are all different types of the tumor. The grade of the tumor, that is grade 1, grade 2, and grade 3. Grade 1 is well differentiated, that is the cells are more or less similar to the normal tissue, whereas in grade 3 it is a higher grade of the tumor, that is the cells are more immature and more uh, prone to develop an aggressive stage of the disease. And the margin status, that is once the specimen is removed, we need to assess if the tumor is involving the specimen or if a little bit of the tumor is left behind in the normal tissue as well. Then lymphovascular invasion and perineural invasion status is also reported. That is, if the tumor cells have invaded the lymphatic cells or the blood vessels is reported. And also the number of nodes that have been removed or the number of nodes which show the presence of tumor is also recorded. And the common nodes like we discussed before is the axillary lymph nodes, the supraclavicular or infraclavicular lymph nodes, and internal mammary nodes. Now apart from these, we need to do an IHC study as well, that is the immunohistochemistry test. This includes estrogen receptor test, progesterone receptor test, and HER2 receptor test along with Ki67 index. These are receptors which are typically seen on breast carcinoma tumor cells, and this helps us to decide on what further treatment can be given. And following this, depending on the stage of the depending on the size of the tumor, depending on the number of nodes that have been involved, and depending on the other organs that have been involved, the disease is staged. Apart from pathological examination, there are radiological investigations which are done to confirm or to find out the diagnosis of carcinoma breast. The first and foremost is the mammogram and ultrasound of both breasts, which looks into the location of the lesion, speculated margins. These are needle-like margins which are seen around the lesion. Microcalcifications. These are tiny calcifications, or as they are seen as white dots in the mammogram film. If axillary lymph nodes are seen, or if any other benign findings are reported. So finally, a BI-RADS classification. So it's called the BI-RADS classification, which is reported in a mammogram report, and this indicates if the lesion that is seen on a mammogram is a benign lesion or a malignant lesion. It gives a clue as to what the lesion is more likely to be. Now, apart from this, we need to do a chest X-ray or a CT chest to look for involvement of the lung, an ultrasound abdomen to look for involvement of the liver or any other organs in the abdomen. A bone scan can be done in advanced stage of the disease to look for involvement of the bones, because bones are a common site where the disease can spread to. A PET-CT scan also is used in case of advanced diseases to look for the extent of the tumor spread. Now coming to the treatment, the carcinoma breast is mainly divided into early stage breast cancer, locally advanced breast cancer, and metastatic breast cancer. And treatment includes different modalities of treatment like surgical treatment where the doctor tries to remove all the visible tumor, chemotherapy which uses medicines to shrink or kill the cancer, radiotherapy to kill the non-visible microscopic disease, certain targeted therapies because cancer cells have certain proteins that appear on the surface of the cancer cell. So if a medicine can identify these proteins easily, then they can easily kill these um, cancer cells. There is also something called as a hormone therapy, where the earlier discussed IHC, that is the ER positive, progesterone receptor or HER2 new receptors, if these are positive in any patient, then we can give hormone therapy to that particular patient. So surgical management can be divided into breast conservation surgery. Here only the tumor is removed and the rest of the breast is kept intact. In modified radical mastectomy, the entire breast is removed, including the lump, including the nipple areolar complex, and also axillary lymph node dissection is done. That is, the axillary lymph nodes are removed along with the lump or along with the breast. Now, chemotherapy can be given as neoadjuvant or adjuvant. It is called neoadjuvant when chemotherapy is given before surgery. This is especially done in case of advanced diseases. Adjuvant chemotherapy is given after surgical treatment. This can be given for early stage of the diseases. Now, the commonly used chemotherapy medicines are adriamycin, cyclophosphamide, and docetaxel or paclitaxel. Usually, we give 4 cycles of adriamycin and cyclophosphamide and 4 cycles of docetaxel. So, these cycles are repeated every 2 weeks, every 2 weekly or every 3 weekly. Then we have radiation therapy. This is mainly done to prevent recurrence, that is, to prevent the disease from coming back. Now, like I already mentioned, in case of estrogen receptor positive patients or progesterone receptor positive patients, it has been found that some drugs have been found to be useful and prevent recurrence and also control the disease. The examples for this hormone therapy is tamoxifen and letrozole. For HER2 new positive patients, certain targeted therapies have been found to be effective. Example is trastuzumab. For patients receiving chemotherapy and surgery or radiotherapy for carcinoma breast, we need to look at how much the disease has responded to the treatment. And we need to assess them clinically as well as using radiological investigations like mammogram of the breast of the chest wall. And we look at complete response, partial response, progressive disease or stable disease. So the patient is in complete response if the entire disease has been removed. Partial response if the disease has partially responded and there is still some amount of disease that is left behind. In progressive disease, there is increase in the present stage of the disease. So whatever stage the patient has come in, little more has increased from what she already has. That is, the disease has not responded to the treatment being taken. In case of stable disease, the disease remains the same before and after treatment. Now, follow-up is important for these patients because we need to look at the late effects of treatment as well as if there is any sign of recurrence that occurs in these patients. Also, their present life status has to be looked into and fertility issues are seen in these patients because of the chemotherapy drugs that they are taking. And all these details need to be recorded along with the date of follow-up and the method of follow-up, that is either hospital visit, by post, through phone or home visit. We should look at these patients for relapse or recurrence. The patient can have a recurrence either in the same region where she already had, that will be local recurrence, or she can have the disease coming back in her lymph nodes, when that will be called as regional recurrence, or the disease will come back in any of the organs elsewhere, and that is when it is called distant recurrence or metastasis. And this again needs to be evaluated separately we need to start the entire process of evaluation like it was done initially for this patient, with biopsy, with imaging modalities or PET scan, and then treatment is provided accordingly. The treatment toxicity and rehabilitation is very important in a patient who has received treatment for breast carcinoma, because the most common complication that she comes up with will be lymphedema. Lymphedema is swelling of the limb. This is mainly on the limb which is on the side of the breast that has been removed, and this swelling of the limb occurs because of lack of lymphatic drainage, because during surgery all the lymph nodes have been removed as part of axillary lymph node removal as part of the surgery. Also, she receives radiation therapy to the same site. Because of this, lymphedema is something a patient always complains of and needs to be looked into carefully and managed as early as possible before it gets worse. Other symptoms include neuropathy, breast edema, and all this is seen with chemotherapy as well as radiation therapy. Apart from these, she will have symptoms of feeling low, or a constant fear of the disease coming back, or other symptoms that needs to be looked into that give a clue to the occurrence of recurrence or distant metastasis. So all these things should be explained to the patient on each visit to the hospital, and the family members as well as the patient needs to be frequently counseled and given reassurance and support. So this is in brief about breast carcinoma, its management, and the details that needs to be collected during the follow-up as well as from the documentation of the disease. Thank you.